Okay, I think we can slowly get going. So still a few people are joining, I can see. So yeah, but I already want to welcome the ones on board to today's Talking 3R webinar. Very exciting talk today to have Alexandra Banach-Brown here from Berlin. Would yeah, start to introduce our speaker today. So yeah, I'm very happy to have Alexandra Banach-Brown here, and she is a methodologist at the Quest Center, which is part of the Berlin Institute of Health at the Charité. And there she develops and delivers preclinical systematic review education, provides methodological support to researchers carrying out systematic reviews of preclinical data, and she conducts systematic reviews in animal models of psychiatry, and also has specialized expertise in applying automation techniques and software for systematic reviews. So in case you're interested, there's also more information about her group on the website, which I can also share the link in a minute in the chat. And yeah, with that, I would yeah, give the floor to you, and happy to hear your talk.
Thank you, Marcus. Thank you for the invitation. Let me see if I can get my slides up there. Great. So it's my pleasure to talk to you today about systematic review and meta-analysis and how they can support the 6Rs. Marcus kindly introduced me. I have a background in animal research and neuropsychiatry, conducting behavioral experiments in animal models of depression. And when I was designing or planning my animal experiments, I looked to meta-research or research on research to design an experiment that fulfilled a gap in our evidence or gap in our knowledge. And that's how I moved into the meta-research field. And like Marcus said, I now conduct systematic reviews and support researchers to conduct systematic reviews with education and infrastructure. I'll give a little bit of an introduction to our team at the Quest Center at the BIH, which is called Camarades. Camarades stands for the collaborative approach to meta-analysis and review of animal data from experimental studies. And we're an international network of preclinical researchers. So I think we have 7 or 8 national coordinating centers, and at Camarades Berlin, we're the national coordinating center for Germany. Camarades is led by Sarah McCann, and we provide support, infrastructure, and education on preclinical systematic reviews and meta-analysis of laboratory data. And we also conduct our own systematic review research, primarily within the field of neurology. So you might be thinking, what is a systematic review? What does it exactly entail? A systematic review is a robust method to objectively and transparently synthesize research evidence to inform decision-making. So the goal here is really to identify all available literature that we have on a research question so that we have as complete and unbiased view of the current knowledge base in a given research area. A systematic review can include a quantitative synthesis, which uses statistical techniques called meta-analysis. And these are evidence synthesis methods that can be applied to any type of research question, economics, psychology, but here we're focused on systematic reviews in biomedical research, and in particular talking about preclinical literature. So this is a simplified version of the research evidence pipeline or the biomedical translational pipeline, where preclinical research in cells and animals is performed to evaluate mechanisms underlying human disease and to test potential treatments. Promising findings are then advanced to clinical testing in humans, and successful treatments are then translated into clinical practice and guidelines. So systematic review occurs routinely in the translation of findings from clinical research to clinical practice, so the treatments that we receive when we go to the doctor. But in preclinical research, systematic reviews can help us to optimize our laboratory experiments and help us to inform translation to clinical testing. Some of the key characteristics of a systematic review are a clearly defined research question with a set of objectives and a reproducible and explicit methodology defined a priori. A systematic search that attempts to identify all available studies that meet these predefined eligibility criteria. An assessment of the validity of the findings included in the review, for example, assessing the risk of bias. And a systematic presentation and synthesis of the characteristics and the findings of the included studies, which can be qualitative or quantitative using meta-analysis. So the benefits of a systematic review include that it provides a less biased summary and interpretation of our current knowledge base than, for example, some other techniques such as a narrative review. The results are reproducible because they follow an explicit and predefined methodology. And they allow for better informed decision-making because they use the totality of evidence that we have and include a critical evaluation of that evidence. And they help to ensure that any new research is fully justified. And this research can include future preclinical experiments, or systematic reviews can help to decide when promising findings should be translated to the next step in the research pipeline. So if we go back to our simplified evidence pipeline, we're really looking at ways to optimize our experiments for this accelerated translation when investigating promising drugs or mechanistic routes. And one of the ways that we're looking to optimize is through the 3 Rs. So the 3 Rs are the cornerstone of animal welfare and ethical animal research. I don't need to go through the 3 Rs with this audience, but they stand for the replacement, reduction, and refinement, and were described over 60 years ago by Russell and Birch. But there are some slightly different definitions and interpretations that I'll go through very quickly. Replacement, the replacement of animal experiments with methods or testing strategies which directly replace or avoid the use of animals in experiments where they otherwise would have been used. So, for example, with tissues, cells, in silico models, or even replacement with human volunteers. A reduction in the number of laboratory animals used to a minimum, and this needs to be done in a way that's consistent with the scientific aims of the study. Not just the fewest animals used, but the fewest appropriate number of animals used in order to ensure robust and reproducible findings. And this number can be decided through an a priori sample size calculation. And thirdly, refinement through minimizing the suffering of animals used in research, and recognizing here that also if an animal is suffering stress or pain during the experiment, this can also impact the outcome. So good science and good animal welfare go hand in hand. Systematic reviews can help us to address research questions that directly inform these classical 3 Rs, the replacement, reduction, and refinement. Systematic reviews themselves are considered an animal-free innovation because they lead to new results and new insights without conducting additional animal studies. By comprehensively summarizing what's been done before, they can help to prevent unnecessary duplication. They can help us to optimize the choice of our animal models or compare the performance and the necessity of outcome tests. For example, by comparing less noxious tests with more severe alternatives and assessing, for example, if multiple testing is necessary. They can help inform sample size calculations and help to refine the duration of experiments and humane endpoints. So I'm just going to show you some examples of published systematic reviews that have addressed 3 Rs questions. This first example is a systematic review looking at separation-induced vocalization, which is an outcome test in guinea pig pups used as a model anxiety and to test anti-anxiolytic drugs. The pups in this test are separated from their mother, and the number of times that they cry out or number of vocalizations is counted. So the data from this systematic review show that anti-anxiety treatment reduced the total number of vocalizations overall compared to control treatment, but that repeated testing had a significant effect on the treatment efficacy. So the effect of the anti-anxiety drugs was significantly smaller in pups that were tested once compared to those that were tested more than once. But from the results, there were no differences between testing 2 to 3 times or testing 4 or more times. So the size of the effect and its variation, along with the impact of the test, so how severe the test is, testing multiple times on guinea pig pups is obviously far more distressing for the animals. Combined, this information can be used to select the most appropriate testing paradigm for a particular study. Another example is data from this study where they systematically reviewed the literature on mouse mortality in stroke studies. So when a mouse died or was euthanized before the end of an experiment, and here they used data from physiological parameters to train machine learning algorithms to predict this mortality. So the graphs here show the parameters that were used, weight change and temperature change in male animals, and weight change, temperature change, and neurological score in female animals. And shown here are the decision boundaries for survival in blue and mortality in red. So this algorithm can be used to help identify animals that will require euthanasia earlier in an experiment so they experience less suffering. And this last example is from a systematic review of animal models of chemotherapy-induced peripheral neuropathy. There are a number of different tests used to measure pain responses in these models, and this review compared the statistical power of these outcome assessments. So it was found that the number of animals required to achieve 80% power with a significance level or a p-value of 0.05 actually varies substantially across the behavioral tests used. So to detect an effect size in the 50th percentile, somewhere in the middle of the graph, the number of animals required per group ranged from 5 animals to 75 animals per group for the different tests. So the test in orange, this Randall-Solito pore pressure test, appears to be the least sensitive and requiring the most animals. So along with other factors such as clinical relevance, results from this systematic review can help to select outcome measures that require fewer animals while still getting the same amount of scientific information. But these classic 3 Rs, replacement, reduction, and refinement, while really critical for animal welfare, only form part of the picture, ensuring that their ethical animal research is conducted. So research on animals is only ethical if it also generates value for science and society. That is, if the findings can be translated to inform better healthcare outcomes for humans ultimately. Currently, this process of translation is unsuccessful in many biomedical fields, with researchers unable to reproduce positive findings from biomedical laboratory studies, and these findings failing to translate to clinical benefit, leading to research waste. Just to highlight the extent of this, this is an example of failed translation in experimental stroke. These data are from a very, very early systematic review in 2006, which identified over 1,000 experimental treatments for stroke, which had been tested in vitro and in vivo models. 600 of these treatments were tested in animals, with 374 reported to be effective at improving stroke outcomes in animals. Of these 375, 97 of them were tested in humans in clinical trials. However, it was only one of these, TPA, or tissue plasminogen activator, an enzyme that breaks down blood clots, was actually effective in improving stroke outcome in humans. So while this review was published over 15 years ago now, the number of experimental therapies tested in vitro and in vivo continue to rise, but the number of treatments that are effective in clinical trial has not changed. There's still only a single drug that has shown efficacy in both preclinical and clinical testing. So it's unfortunately still a very relevant problem. Of course, luckily, there are other treatments for stroke, but these have largely been developed outside of the traditional translational pipeline. This phenomenon isn't unique to stroke. It's been shown across a number of neurological domains and multiple other biomedical fields. So the scientific value of many experiments seem to be low. And systematic review has helped to identify or quantify many of the factors that are thought to contribute to low scientific value in animal experiments. And these include threats to internal and external validity. These are 2 important types of validity in preclinical research. Internal validity relates to the truth in the included studies. Do we trust what the studies are telling us? And external validity relating to the generalizability of the findings. So do the studies represent the biological truth? Do they represent the truth in real life? Are the results of our animal studies generalizable to that of humans? And threats to validity can include risks of bias, like failing to blind or randomize experiments, poor generalizability, for example, by using the wrong model, and low statistical power. Publication bias and poor reporting are also issues thought to contribute to low scientific value in animal research, and I'll touch on some of them a little bit later on. So this dimension of scientific value in animal research is captured by an additional 3 Rs: robustness, registration, and reporting. So robust study designs include aspects such as high internal and external validity, for example, implementing measures to reduce the risk of bias by conducting randomization, blinding, and performing sample size calculations. Pre-registration of study protocols allows us to transparently understand what research is currently being done in the field, to identify delayed or unreported findings, which can also help to quantify publication and reporting biases. And complete and timely reporting of experiments allows the field to properly evaluate exactly what's been done and how much we trust the results, allowing also for easy replication of the findings. So these 6 Rs, replacement, reduction, refinement, robustness, registration, and reporting, they work together to support ethical animal research, which is not only critical for animal welfare, but also for ensuring that our laboratory animal work contributes to improving human healthcare. So I'll just go through a couple of examples about how systematic reviews can help address these additional 3 Rs in our 6 R model. Firstly, they can help to ensure that every new animal experiment addresses a relevant gap in our knowledge, and that our new animal experiments are fully justified by assessing the quality and the range of existing evidence. And they can also be used to assess the generalizability of findings. We can assess risks of bias, like the lack of randomization or blinding, and estimate their impact, which can inform how much we trust the results of individual studies, as well as the body of evidence as a whole. And we can estimate the extent and the impact of publication bias. So this is an example of the impacts that low internal validity can have on the evidence from animal studies, in particular risks of bias. NXY-059 was an antioxidant drug developed to treat ischemic stroke. It was tested in animal studies and shown to be very effective. So in over 400 animals, it was shown to improve stroke outcome by 44% overall. It was then advanced to clinical trial and tested in 3 clinical trials involving over 5,000 patients. The largest of these trials had a neutral outcome. So it showed that the drug had no effect on stroke outcome. And in the 48 hours following the publication of these results, AstraZeneca, who developed NXY-059, saw a fall in their market value. So what happened? How were the animal experiments so wrong? Well, systematic review of the preclinical literature provided some answers. So from the 400 animals that were used, there were 29 experiments, and these were synthesized using meta-analysis. So this gray bar at the back here is the 44% combined efficacy, together with the 95% confidence intervals around our overall effect. And the data then stratified according to whether or not measures were taken to reduce the risk of bias in these experiments. And we can see that when experiments were randomized, so they were at low risk of bias, they reported much smaller effects than studies that didn't randomize or were at high risk of bias. And this pattern was seen for the blinded conduct of experiments and the blinded assessment of outcome. And none of the animal experiments reported all 3 of these measures. So the reported efficacy of NXY-059 was confounded by low internal validity. How prevalent is this? We've looked at over 2,500 experiments in the Camarade's systematic review database, and whether they took measures to reduce the risk of bias. These are the results across animal models of Alzheimer's disease, focal cerebral ischemia, glioma, Huntington's disease, intracerebral hemorrhage, experimental autoimmune encephalomyelitis, myocardial infarction, and spinal cord injury. And as you can see from these 4 graphs, the reporting varies across the fields. Overall, this is the overall reporting of some of these items. On the gray bars, it's low. with 25% on average reporting randomization, 30% reporting blinding, 10% reporting conflict of interest, and virtually no studies reporting sample size calculation. So we have reason to believe that a large amount of the published in vivo research is at high risk of bias. But this systematic evaluation of the literature has allowed us to understand where our evidence might be at highest risk of bias. So systematic reviews of biomedical studies have also been used to assess the range of existing evidence and the quality to inform translational decision-making. So using systematic review to inform clinical trial design, including informing decisions such as which drugs to take forward to clinical trial, selecting the timing and the route of the drug administration. All clinical trial teams may simply want to gain an overview of the literature prior to commencing a human trial. And one example of where preclinical systematic reviews have been carried out in the context of this include the MS SMART trial for multiple sclerosis, which was informed by a preclinical systematic review, as well as an ongoing trial in motor neuron disease called MND SMART, which is employing a living systematic review of the in vitro and the in vivo evidence to identify promising drug candidates to repurpose for patients in their MND trial. This living review technique is facilitated by software and pipelines called Systematic Online Living Evidence Summaries, or SOLs we call them for short, which use automated processes to synthesize and summarize evidence from a given research domain or topic. And these results are continuously reported in a curated way and displayed in an online dashboard. So these automation tools systematically retrieve, screen, and tag evidence for important information that can inform decision-making in clinical trials. Systematic review can also be used to inform model selection. This is a review of data from 2 different rat strains used in research on preeclampsia, so the sudden onset of high blood pressure during pregnancy. Here, the authors mapped out the vascular responses during pregnancy to see if there were any differences between the strains. So they found that Sprague-Dawley rats showed vascular function more similar to that of preeclamptic women, while Wistar rats were more similar to that of a normal human pregnancy, indicating that Sprague-Dawley rats are a more appropriate strain to model preeclampsia, and they have higher external validity. So I mentioned publication and reporting biases earlier, and this is a problem in preclinical research, and they can affect what we think we know about an area or a research domain. So publication bias occurs when neutral and negative studies take longer to be published, they remain unpublished, and this means that they are less likely to be identified in a systematic review. And when we have an overrepresentation of these positive studies in our review, this can lead to an overstatement of efficacy in meta-analyses. There are also additional reporting biases, including selective outcome reporting, where only certain outcomes are reported, usually the ones that are significant, and selective analysis reporting, where multiple different types of analyses are conducted on a data set, but only one is reported in the final report. This is an example of publication bias and the impact of publication bias in the stroke literature, which was identified through combining data from several systematic reviews. So we can identify publication bias using something called a funnel plot, which is a plot where the effect size from each experiment in the data set is plotted against a measure of its precision. So if there is no bias present in a data set, we would see a nice even funnel shape or this triangular shape with more precise studies centered around the overall effect estimate shown with the vertical line, and the less precise studies scattered evenly on both sides. So a gap in the plot where we should see imprecise studies with a small or negative effect suggests that there may be publication bias, that these studies haven't been published or are missing from our data set. And we can estimate the number and the effect size of these hypothetically missing studies using a technique called Clomans-Fill, and then calculate an adjusted overall effect incorporating these hypothetically missing studies shown in the red line. And this, you can see, has shifted towards the zero effect size. So in this data set, it's estimated that 16% of stroke experiments remain unpublished, leading to an overstatement of efficacy of approximately 30%. So systematic reviews are a research methodology like any other. There are challenges and limitations to systematic review, and I think it's important to highlight some of them here. Systematic reviews are sometimes seen as a kind of easily producible or publishable unit, but they are resource intensive to do and require a team of researchers to carry out, especially in fields where there's lots and lots of literature. And although automation tools are being developed, validation across domains takes time. We want to make sure that the automation tools are working accurately, and they can't replace all stages of the systematic review. Poor reporting and biases in a field of literature can limit our ability to form robust conclusions in a systematic review. The phrase rubbish in, rubbish out is sometimes used to describe them, but systematic reviews have allowed us to identify problems with the preclinical literature and help inform and justify improvement strategies. So they've added value in these situations where the included studies have low quality. And there's a huge increase in the production of necessary and conflicting reviews. And the extent of this problem has also been studied using meta-research techniques and was specifically highlighted by the study in 2016 by Professor John Ioannidis, which found that the number of systematic reviews published since the 90s has increased exponentially compared to any other type of research, and that a lot of them are low quality or may be done with a predetermined agenda. So given that systematic reviews are at the top of the evidence-based pyramid in evidence-based medicine, and they're gaining recognition in preclinical research, we need to make sure that our preclinical reviews aren't adding to the production of low worth evidence syntheses. So how can we use systematic review to help us improve our research? Well, we can search for published systematic reviews in our field to help inform the design of our next experiments. We can learn what makes a good systematic review and how to appraise and interpret them. Like Professor Ioannidis' study found, not all of them are as good or good quality. There are tools like the PRISMA guidelines and the AmStar checklist, which can help in the appraisal of systematic review quality. And where feasible, performing a systematic review of your own to inform experiments in the field, of course, making sure that it's necessary and conducted to international standards. How can we make sure that our preclinical research has the largest impact and provides most value to our field? Well, make it synthesizable. Ensure that study results can be easily combined with existing knowledge in any evidence synthesis, including systematic reviews, to contribute to the body of knowledge as a whole and to be most efficiently used to inform the next steps in the evidence pipeline. But just to point out how critical some of these steps are to also ensuring that research can be synthesized is to pre-register the study, follow reporting guidelines such as ARRIVE for animal studies and RIVER for in vitro studies when reporting and publishing work, and assure the reporting of all data are openly available. If you're curious to hear more about systematic reviews or are considering a systematic review approach in your research area, I'm now going to introduce you to some of our services and educational offerings and introduce you to our community project as well. So we offer a range of courses to increase methodological skills and promote critical appraisal and experimental design standards, mainly geared towards animal researchers, but systematic review of in vitro studies is becoming more and more common. Our introductory course, Introduction to Systematic Review and Meta-Analysis, is held regularly, provides a comprehensive introduction, and I'm very happy to post the links in the chat where you can sign up for our next workshop. We also have a number of on-demand courses focusing on specific aspects of the systematic review in depth, including protocol development and critical appraisal. In addition to education, we also have one-on-one advice for researchers wanting to carry out a systematic review. This can range from refining a research question, developing a protocol or statistical analysis plan. We provide support on how to use SURF, or the Systematic Review Facility, which is a free software designed specifically for the systematic review of animal studies. And we've developed preclinical systematic review and meta-analysis guidance in the form of a free online wiki with step-by-step instructions and links to resources at all stages of a review. So to ensure that systematic reviews are providing the highest value to the field, we're moving towards creating communities for open research synthesis to integrate preclinical research and evidence synthesis. These communities are made up of preclinical researchers, evidence synthesis, statisticians, information specialists, who work together to perform systematic reviews to inform future preclinical studies and translation in their field of interest. And with synthesis as a goal, studies are designed and reported transparently in a way that's synthesizable and feeds directly into this evidence pipeline. And this process supports better animal welfare and higher scientific value of our research overall. And the two arms of these communities are that increase the awareness of systematic review and make evidence synthesis both feasible and accessible. The two arms are education and infrastructure. And with this project, we are bringing together these resources. So some of the resources I've talked about today, including automation tools. We've kickstarted this project to grow the community. And with this, with the community at the center, this fundament of resources enables the community to be supported in conducting systematic review, enabling a community of practice. So we've brought together all of these resources on a digital hub at pausehub.io, along with a digital discussion forum. And this is an initial framework to bring together these tools, connect individuals and groups interested in learning about systematic review or carrying out systematic reviews. A very, very important aspect in the development of communities for open research is the collaboration partners and the collaboration institutes that have been engaged with the project from a very, very early stage. So including, in addition to Camerades Berlin, we have 4 different university medical centers across Germany, which you can see on the map here. Our partner institutes pilot education and training programs, help to identify barriers and enablers to systematic review across Germany, and are involved in developing strategies to strengthen systematic review education and conduct. And we work together to co-create resources for the community. So cause partners really play a very important role in shaping how the community grows. I'd just like to highlight one of our partners who are actually also in the 3R Baden-Württemberg network. And this is the research group of Dr. Ralf Václavic and his team at the 3Rs Freiburg and the Department of Neurosurgery at Uniklinikum Freiburg. They have a very unique team that work both face-to-face with patients in the neurosurgery department, as well as evaluating preclinical evidence to inform treatment strategies available in their clinic. And their main topic is increasing evidence and the predictive value of preclinical research in spinal cord injury. So I invite you also to take a look at their website and check out their very, very cool work. So if any of the topics have sparked your interest today, or you're just interested in hearing more, we invite you to join the community. You can check out our digital hub, which has resources and information, our discussion forum, join the discussion, hear what other researchers are up to and how they're using systematic review tools in their work, and sign up to receive updates about workshops, resources, or news in general via our newsletter. And we're also very newly on LinkedIn as well. So if you're there, you can find us there as well. So thank you very much for your attention today. I will close the presentation now and leave some time for questions.
Yeah, thanks also from my side. It was a very great webinar. Thanks a lot. So yeah, please feel free to use this F&A button if you have any questions to the webinar. There are already some coming in, so maybe we we will start. So there's one question asking, what is the minimal sample size for systematic review? I can see that this is easy to reach for drug testing, but other fields have 3 to 5 labs that publish and maybe 20 papers on a topic with very different experimental approaches.
Yeah, so a systematic review needs to be meaningful. You need to have a specific question that you're trying to answer. So any available evidence that helps you answer your question. So 2 studies is better than 1, right? However, for some of the statistical approaches in meta-analysis, it is more important to have data from multiple studies so that the analyses, the meta-analyses themselves also are not at risk of being underpowered. So that's a consideration to have. A lot of the techniques and the methodology for systematic review of preclinical studies have been adapted from that of clinical trials. So the Cochrane collaboration has been pinnacle in developing systematic review techniques for translating clinical trial evidence into clinical practice. However, there are some differences between the clinical trials and the animal research that mean that we've adapted the methodology to these. So clinical trials, there may only be 2 or 3 clinical trials in a given field, but these trials have hundreds or thousands of patients. If you look at the characteristics of animal studies, you may have lots of small animal studies, but the animal, the group size rarely exceeds 6 or 10 animals per group. So this is a consideration to take into account when conducting some of the statistical analyses. But for a systematic review, depending on your question, depending on the scope, there's no minimum sample size as such.
Okay, maybe questions from my side. So could you explain the difference between systematic review and scoping review? What are the main differences, and also in respect, particular for animal studies?
Yeah. So scoping review is something that's usually conducted when there is not a good understanding of how broad a field of research is. So you may conduct a scoping review on quite a shallow question. The idea is just to get a kind of very, very broad understanding of what type of literature in this field is out there, and try to kind of see what is out there before conducting a specific systematic review, which might have a very, very specific outcome. So you might want to see, what is the effect of this drug on this behavior in these animals. But if you don't know which behaviors have been tested, you can't ask that is out there, and then that enables a more specific systematic review. Does that answer your question?
Yeah, thanks. So what is the ratio of pre-registration of animal systematic reviews and their publication of the full systematic review? Can you say anything on that?
Yeah, so one of the hats that I wear is an administrator for Prospero, which is the International Prospective Register for systematic reviews, where we review the protocols for animal systematic reviews. We have seen a huge increase in the submissions at Prospero, which is really great to see that the community is so enthusiastic about conducting, at least starting the systematic reviews. Of course, systematic reviews, it's not something that just takes a couple of months. So the follow-up time for when people have submitted a protocol, that's their plan for how they plan to conduct their systematic review, and how long the systematic review actually takes. This can vary greatly. Depends on the number of resources that a given team has, how large the field of literature is that they're trying to review. But as part of in the Prospero team, we're evaluating to see how long it takes them to submit it as a publication as well.
Okay, so it does not seem that there are any further questions. So everything was very clear.
Wonderful.
So yeah, with that, I would like to thank you. Thank you, Alexandra, and have a nice evening.
Thank you, everyone.
Goodbye.